Good evening, everyone. Thank you all for joining us for another wonderful patient webinar event. Modern vision correction, LASIK, EVO ICL, and today's refractive options. My name is Gabriel Macias, Business Development Manager for Harvard Eye Associates. It is my pleasure to introduce our presenter for the evening, Dr. John Hovanesian, specializing in cataracts, refractive, cornea, and pterygium surgery. Dr. Hovanesian is an internationally recognized leader and innovator in cataract, corneal, and laser surgery. Newsweek has recognized him among the top 35 eye surgeons in the US out of 17,000 eligible colleagues based on a poll of his peers. The Ophthalmologist, a UK publication, has named him among the world's 100 most influential people in eye care. A board certified ophthalmologist and faculty member at the UCLA Stein Eye Institute, he has published two widely used eye surgery textbooks, one on the subject of refractive cataract surgery and one on pterygium surgery. Dr. Hovanesian, thank you so much for being here to host tonight's patient webinar.
Thanks, Gabe. It's great to see you. And
Likewise.
thanks for everybody for joining. We're going to make this fun tonight. Gabe, I have a question for you. Do you know what they call Bigfoot in Europe? It's an important question. Bigfoot in Europe. They call him Big Meter.
Nice. I was gonna say I would think about it for as long, but we'd be sitting here a while if I tried to figure out what it was.
That whole metric system thing they have over there, Big Meter.
Right.
So you can tell anybody that joke. It's completely safe. I don't know. Maybe somebody from Europe might not get it, but anyway, nice to see you and thanks for kicking off the webinar tonight. We enjoy people, we enjoy our patients, and hopefully you'll enjoy listening to this webinar. And I think we have, I'm not sure actually, Gabe, do we have a way for people to ask questions through the system? I think there is a Q&A feature. Do we have it enabled for the,
Yes.
all
Yeah,
right.
they are able to ask, and then we can address if there's room in between or at the end, depending. So
Thanks, buddy. I appreciate it. So we'll maybe make use of that. I'm going to kind of take you through some information and tonight's focus, although you heard Gabe talk about, I do also cataract surgery. I do a variety of surgeries, but really everything related to helping people to have less need for glasses is what I love. And cataract surgery is part of that these days because we have wonderful technology that helps people who are older who have cataracts to see well when they go through that procedure. But the majority of our LASIK patients are younger folks who would like to see with less need for glasses. And I'm going to bring up some slides that will make this a lot easier to understand. So let me just share the correct screen here. That's the one we want. And hopefully that looks right on your screen as well, showing you what I'm seeing. So we're going to talk about modern LASIK correction. And so the good news is technology keeps getting better, and we've got better and better ways of helping people see better. But there's not a one size fits all solution. Not everyone is a great candidate for LASIK. Not everyone is a great candidate for other treatments that we'll talk a little bit about. But we will talk about what makes you a good candidate for some of these different things. And really, of course, the best way to understand this is to see us in the office. And we don't actually charge anything to do a brief evaluation to see what you're a candidate for. And then and give you enough information so you can make a decision if you want to move forward and learn more and then go forward with the procedure. We've been around for more than 50 years, and our practice is not interested in pushing people to do something they're not comfortable with, but we are interested in helping people be educated about what the possibilities are. And the possibilities are kind of wonderful. Having done this for really all my professional career and seeing great technology get even greater, it's a thrill to help people see with less need for glasses and getting rid of glasses in most cases. And um, it's scary, and there's cost that's part of it, and that makes people, have pause. And our job is to help you understand. And when you understand, you can be in a better position to decide what's right for you. So one of the first questions I often get is, well, how do I know if I'm really a candidate for a LASIK procedure or another procedure? Well, first thing we look for are your eyes stable? By the time you're in your early 20s, and sometimes as young as age 18, people often have a stable prescription. Their eyes stop growing and they don't change much. And you may get a little, if you see your eye doctor every year or so, you may see a little change in the prescription, but not a lot. So being age 18 is we usually try to wait until at least age 18. And then the eyes have to be healthy. If you have significant other disease, and that's something we look for when we test, that might not make you a good candidate, particularly if it's a problem in the front of the eye and the cornea. And there are different procedures we have. Here are three of the ones that we use most commonly. Right in the middle, where it belongs, is the leading procedure that we perform, LASIK. It's a really simple concept. It does involve two steps, but a procedure where we very precisely put your eyeglass or contact lens prescription directly on the cornea, actually inside the layers of the cornea by lifting a layer of the cornea, and then treating with a laser, and then laying that layer back down. PRK on the right is also an equally precise and similar procedure. It's actually a little simpler. Um, it achieves the same type of vision as LASIK, but it is a little bit longer recovery time. Some people like it because it is a simpler procedure. Theoretically, has very slightly less risk. Certain people with certain occupations are required to have PRK, although most occupations, even if you're in the military or a pilot, either procedure, LASIK or PRK is okay. And on the left is EVO ICL. We'll unpack each of these just a little bit, but that's a procedure that's entirely different approach. Here we usually, for people who are more nearsighted than a little bit nearsighted, people who are way at the high end of the spectrum, we can't necessarily treat with LASIK. And there's some overlap between what we can and cannot treat with LASIK, but a lot of those patients can have EVO ICL. We'll talk about that. So, all of them achieve great vision. That's the good news. All of them have a fairly short procedure of, let's say around 20 minutes, and all of them have fairly quick recovery time. We say PRK is up to 4 weeks, but it's really, that suggests that you're not going to be functional for up to 4 weeks, and that's not true. You can go back to work the next day with any of these procedures. You can function in most ways. We don't like you in a swimming pool with any of these procedures for about 2 weeks. And other exercise you can do usually about a week after any of these procedures. But the next day after any of these, you can walk, you can drive, you can read, you can shower, you can use a computer. You may have a little bit of blurriness in your vision, but most people can function just fine. Those are some important distinctions of the procedures. We'll get into more detail. It's important to understand the different ways that we see if you're nearsighted, farsighted, if you have astigmatism. A lot of confusion happens around these things, so I want to unpack that. And by the way, if you have questions that are coming up along the way, especially if they're clarification items, just go ahead and put them in the question. And you'll see me drinking my water, occasionally taking a pause. And if you're wondering what my mug says, it says, this was given to me by my staff, it says, God only made a few perfect heads, and he covered the rest with hair. So, perfect shape. You see, if we were to reshape your cornea, we'd want it to be a perfect shape like this. So, all right, let's move on. How we see. So the eye is an amazing, miraculous, complex organ that has different parts that help us see. Starting at the front is the cornea. That's the front window of the eye, and that is the transparent layer that we see through. And behind that, you have a colored tissue, the iris, which has an opening. The pupil is actually just an opening. It's a hole in the iris. The colored part of our eye is what gives it its color. It's what gives me blue eyes. And then behind that, we don't see it because it's pretty clear and it's in a dark area of the eye. It's called the lens. It's the lens inside our eye. There's a cavity called the vitreous. And then there's a retina. And the retina is like the film in the back of a camera or like the sensor in the back of a digital camera. And then an optic nerve, which just is the little cable that connects that tissue to the brain. And of course, there's a blood supply, arteries and veins that run to this, and muscles that move the eye. I think you can see my mouse pointer on the screen, and that's what you see there. So how does this all work? Well, people who have normal vision because they have when there's an object out in space here, here's a candle. It focuses through both the cornea and the lens of the eye, and then the image that's formed comes into perfect focus right on the retina. So we have a clear image of what's out there in the world. With nearsightedness, it doesn't fall on the retina. It's a little hard to tell from this picture, but it actually ends up in front of the retina. It's almost as if the eye is too long. The length of the eye is too long, and that means that it's sort of it focuses in front of the retina. In farsightedness, so let me back up for a second. So when you're nearsighted, what this means is that you have great vision up close. You can see, usually if you're young and you're nearsighted, you can see a lot of tiny things real well, but it's hard to see far away. You can't make out road signs, can't see the captions on the TV, things like that. And of course, there's different degrees of this, right? You can be super nearsighted and you're legally blind for distance vision. You can be a little bit nearsighted and see okay, but not great. But that's all nearsighted. Farsighted is the opposite problem. Here, optically, what you have is the image is formed, the clear image is formed behind the retina, so it's as if the eye is too short. So it's the opposite problem. And in this case, you may not know you have farsightedness if you're young enough. A lot of people who end up farsighted have the best vision of anybody they know when they're a kid. They can see everything far and near. And the reason is that when you're farsighted, it's necessary to see well for your eyes to strain just a little bit to see distance vision. And then if you want to see up close, they have to strain even more. Well, when you're a kid, you got lots of flexibility in the lens of the eye. You can flex and you can see far and you can see near. But as you start to age, the first thing that goes is the up close vision. And you start to need reading glasses to see up close. And eventually, you don't need glasses just for reading. You need them for distance as well, far and near. And so hyperopia or farsightedness is the disease that keeps getting worse. And it's correctable. You can put on glasses, but you need more and more prescription to do this. And yet we can correct this condition with LASIK. We can correct it with other procedures as well. Now, astigmatism, a little confusing because both nearsightedness and farsightedness that I talked about already, they assume that the image of your eye is kind of the same regardless of what part of the focus light is coming through. But if you have astigmatism, the front of the eye isn't shaped exactly like a perfectly round sphere. My head's not exactly a sphere. It actually is more like an astigmatic surface because one curvature is different from the other. And in an eye with astigmatism, there's sort of this warped curvature to the front of the eye that causes the focus point to kind of break up into multiple images, and so that it's hard to bring it into one sharp point of focus. Well, with special lenses in eyeglasses, we can really make it more clear, and that's what we often wear for astigmatism. But we can also correct this condition with LASIK and PRK, and with the EVO ICL as well. So let's start with the most common procedure, what we get asked a lot. What is the procedure itself with LASIK? So basically, it's a great alternative to glasses and contacts. It's been FDA approved for almost 30 years, really 20 plus years. I'm going to say even more than that. It's about 30 years. And it can correct nearsightedness, it can correct astigmatism, or it can correct both. It can correct farsightedness. So any of the things we describe, it can correct. Lots of people are very comfortable with this concept because they have 6 friends who've had it, who are all happy. And that's good because there's been lots of study of safety and effectiveness. It's a procedure that uses lasers to do virtually everything, although the surgeon has to handle your eyes and do important things to make sure that things go well. It's a procedure that is so precise and so successful because it is so accurately performed with the lasers that we have. We'll talk a little bit about the lasers that we have. So it results in excellent quality of vision, and most patients are thrilled with the results they get. Because we've done millions and millions of these procedures, you may have seen in the media stories of patients who have results that are less than ideal. And of course, that with any medical procedure you have for any condition, there's a chance of things that don't go well for you. It's extremely rare to have an outcome that is undesirable with these procedures. And in not all, but in many cases, we can identify people who are at risk. Our approach in our practice is not to push people into any surgery, not to push them, not to shoehorn them into one thing versus another, because we perform all the different procedures. And we also, work with a whole network of doctors who prescribe glasses and contact lenses. Whatever's right for you is right for you. And our job is to help you determine that, but based on good education and good understanding. And if you choose not to have a procedure, great, as long as you find a solution that's right for you. In the procedure itself, we use a proprietary technology that basically measures and then corrects the unique irregularities of your eye and starts with creating a map of the shape of the eye. So I described nearsightedness and farsightedness and astigmatism, but it's actually a little more complicated than that. The shape of your eye can be pretty detailed. So we create a map and then we prepare the eye and then we deliver that personalized treatment to the eye. So the map is just a machine that creates this remarkable wavefront uh, map of the eye. And what that basically means is that unlike measuring for glasses, where we have a certain amount of precision, we've got way more precision. We say 25 times more. It's this type of technology that was used in like the Hubble Space Telescope, the Mir Space Station, to give ideal optics, or as close to ideal as possible. Preparing the eye is done in the procedure room, and we give you a little mild tranquilizer to just take the edge off your nerve. So most people, are really just fine. There's no pain. We put in drops that give you numbing, so there's no discomfort. There might be a tiny bit of pressure during one part of the procedure, but it's not uncomfortable. And then a laser, which uses an ultra fast beam, there's nothing you can see and you don't feel anything, creates the layer in the cornea that we lift out of the way. And then using a second laser that's right next to it, so you don't even get up. We just move the chair a little bit over the gurney that you're on. We move it over onto the other laser. We can deliver that map that creates the more ideal shape of the eye to the eye itself. So before the surgery, there's a few measurements. There's some real careful work that we do to make sure that there's an office visit where you come in and we'll actually dilate your eyes and do multiple sets of measurements. If you wear contact lenses, we like you to have those off for at least a week. If you wear soft lenses, if you wear hard lenses or gas permeable lenses, you really want 2+ weeks. And that's because your eye molds to the lens. And then when the lens comes off a couple weeks later, it takes a couple weeks for it to go back to its normal shape and therefore its normal measurements. Well, we want your normal measurements unaffected by the lens. And that's why we ask you, if you wear hard lenses, to have them out 2 weeks, soft, try to have them out for a week. The whole exam takes sometimes about an hour because there's a couple steps to it. But we want to get this right. And we use an old expression that comes from the world of woodworking, which is we measure twice and cut once. And really more like measure 17 times and treat once. On the procedure day, as I said, we give you some numbing drops and a little mild tranquilizer. You may feel a little bit of pressure, but most people have no pain. And then we treat usually both eyes on the same visit. It takes about 10, let's say for both eyes, maybe 15 minutes to do the whole thing. Afterwards, best thing you can do right after procedure is go home and sleep. And you may have a little bit of blurriness, and because you've had the tranquilizer, you should have somebody else drive you home. Don't want to drive yourself home. Sleep, nap. You can skip any eye drops during that time and then play catch up later. We'll have you for the first 24 to 48 hours using some lubricant drops to keep your eyes comfortable. And then also some, drops that you take on a approximate schedule to try to, keep your eyes safe. Eye LASIK is the technology that we use. It's the specific laser system. It is the most advanced technology in the world for doing LASIK, and it involves this system called iDesign, first of all, that measures 1,200 points on the eye to create this map that I described. And then a femtosecond laser, that's the laser that makes the flap in the cornea. There's no blade involved, and the precision of this is just remarkably good. And then the excimer laser, which is the second laser I mentioned, is a very advanced, and it delivers that map that we described from the wavefront system. So the vast majority of patients see better than 20/20. The vast majority can drive without need for glasses or contact lenses. If you're young enough, you won't need them for reading up close. If you're older than 45 or 50, we can talk about ways to help you read as well as have distance vision. And there's some strategies for that take a little more time to explain that I won't get into here, but are really good for a lot of our patients. Very high acceptance of this procedure because there is such freedom from glasses that comes from it. So great, let's proceed. Let's talk about another procedure. So the goal, of course, of any of the procedures we do is to get you out of glasses and contact lenses. And LASIK is one great way to do that. And I'm going to just go back and review PRK. PRK, think of it as just like LASIK, but maybe a few more days of recovery time. And think of it as we don't need to use this laser. We just use the one that reshapes the cornea on the surface. So instead of cutting the cornea with the first laser, we wipe away the surface cells and then treat directly on the surface. And it sounds like a simpler procedure, and it actually is. And although the recovery is just a little bit longer, for a lot of people, it's desirable. For a lot of people who are prone toward dryness of the eyes, it can create less dryness. And there are a couple of other theoretical advantages that lead about 10%, maybe 15% of our patients to choose PRK instead of LASIK. But, it's 80, 90% LASIK that we do. EVO ICL is a completely different technology we're going to talk about now and for a few minutes. And this tends to be for people who are more nearsighted than we can normally treat with LASIK. In this procedure, we actually add a lens to the eye. ICL stands for implantable Collamer lens. So it's actually an implantable lens that works in the eye to correct your nearsightedness. It's an additive technology. Unlike LASIK or PRK, where we're actually removing tiny microscopic bits of the tissue to change the focus, here we're adding a lens. Now, where does it go? Your eye, I gave you an anatomy lesson before, and I'll revisit that here. So we have the lens of the eye, and we don't do anything to your existing lens. We have the cornea, that's the front window. We have the colored iris. And then there's a space in here called the ciliary sulcus. And it goes in the ciliary sulcus behind the iris and in front of your lens. And it vaults, and just like this, there's a little fluid layer in between. So it's not even really touching the lens, except perhaps just at the very edges. That allows it to, first of all, be removable, even years and years later. In fact, later, if you have other eye surgery, let's say you're 25 and you have EVO ICL surgery, and then 40 years in the future, you have cataract surgery because the lens of the eye gets cloudy. That's a different problem that happens in people as they get older. And we have to remove and replace the lens with an artificial lens implant here. And so if we do that and you have an ICL in place, it's no problem. We can just slip that ICL out, even 40 years later, and we can do the cataract surgery. And the advantage here is that we have never altered the cornea, so we have an eye that's been really treated in a very gentle way. That's the advantage of this technology. And the cornea has been unaltered, so it allows us even better optics for cataract surgery down in the distant future. Sounds like something brand new, but it's actually not. This has been used outside the US for more than 20 years. It's been FDA approved in the US for 15 years. I was involved even longer ago than that in these technologies when I was at UCLA, when we were doing the clinical trials, and they really do work well. Around the world, this has taken off in Asia, where there's a huge number of people who are very nearsighted. And so 2 million procedures have been done. So this is not a new idea or something that's experimental in any way. Among people who are, in the 20 to 40, mid 40s group, it has really been a very successful, and it's one of the fastest growing procedures, where LASIK is a very mature technology that's, slowly getting slightly better over time. This is one that, has not been fully adopted yet. And so we're seeing it grow. So what makes you a candidate for this? So we just talked about the age group. Nearsightedness. Now, so this is, we say -3. If you wear contact lenses, you might know your prescription if you wear glasses too. But many contact lens wearers know the power of the glasses. Even up to -20, that's really nearsighted. We can do this procedure. Usually, if you're -3, -4, probably you're a better candidate for a LASIK procedure. But above that, meaning more nearsighted than that, we certainly think this is an appropriate choice. And we really can't do LASIK for people who are beyond about -7, -8. So it's just simply a better optical procedure, and achieves really good results. Just like with LASIK, you need to have a stable eye, and their eyes need to be healthy. So we help you determine that when you come see us. And sometimes we'll help you determine that by collaborating with your primary eye doctor if you have a doctor who's been seeing you for a lot of years. We're happy to work with them and look at your history. What's nice about this procedure, um, theoretically, it's reversible. You know, if there's any reason that it's not good for you, and that's never happened to one of my patients, we can take the lens out. The only time it's happened to one of my patients is when they've gone through cataract surgery many years later. Um, doesn't tend to worsen dry eye like can happen with LASIK and other procedures. It takes about 20 minutes or so, and you're back to most normal activity really quickly. So not a lot of downtime with it. What other options are there? We're almost at the end here, but refractive lens exchange. Here's a procedure that most people probably never heard of. And this is a procedure typically for folks who are either very farsighted, meaning that they're beyond what we can correct with LASIK, and we don't have an ICL, an EVO ICL procedure for people who are farsighted. It only works for nearsightedness. But LASIK and PRK can work for farsightedness. But if you're too farsighted for those procedures, sometimes we do this procedure. And if you have meaningful amount of cataract in your eyes, this is often a better procedure. So refractive lens exchange is a procedure that is basically identical to cataract surgery, but we give it a different name because we're doing it for a different reason. And so with refractive lens exchange, we're taking the lens that you were born with out of the eye and putting in an artificial lens in its place. That's cataract surgery. And it's refractive lens exchange when we're doing it to help you see better with less need for glasses. And it is a better choice for people with the conditions like I described, high farsightedness, or if you've got cataract, because if you've got some cataract, meaningful amount of cataract, probably with time it's going to get worse. And what that means is that if we do LASIK and you've got a developing cataract, your prescription is going to change and the quality of your vision is not going to be great. You're better served by just going in and replacing that maturing lens and putting in an artificial lens that never gets old, never wears out. You'll never get a cataract again. And we've got whatever correction of your vision that procedure, that lens implant can provide. So like an EVO ICL, a lens implant is a permanent, well, EVO is sort of temporary because most people get cataracts later in life, but it's a permanent correction when we do refractive lens exchange. And you'll never need future cataract surgery because the lens has been replaced. And so it has some really nice advantages. And this is also a very fast growing procedure because increasingly we've got folks who are a little bit older and want to see better, and they're getting frustrated that their eyes aren't as good as they were 20 years ago. And this is just a perfect solution that makes them very happy. So wrapping it all up, how do we decide what's right for you if you're thinking about surgery? You know, this is what happens during a visit in our office. Some of you listening may be candidates for EVO ICL, some may be for LASIK, some may be for PRK, some may be for refractive lensectomy, and some may be for no procedure. And that's okay with us. But we like to help you to figure out what's right for you. And all of them have advantages of their own and patients who they're best for. We encourage you to go ahead and scan this QR code, or you can call our office to schedule a consultation at no cost with one of our surgeons. And one of the nice things about our office is you're not going to just see staff, you're going to see the surgeon who would do your surgery. And we'll have it could be me, it could be one of the other wonderful refractive surgeons at Harvard Eye who sees you. And of course, you want to see me because I have the most perfect shaped head here. So um, anyway, I'd look forward to seeing you, and any of our doctors would. And so I'll be happy to take any questions. I'm not seeing any right now in the QA tab. At least I don't think I do. And we certainly welcome you to see us in the office. And Gabe, I have another question for you, buddy.
Go for it. I'm ready.
Um, do you know how you can tell a dad joke?
I don't.
It's apparent. It's apparent. All right.
They never fail. They never fail. I love it. I'm putting them in my Rolodex, because I'm going to need them for the future.
Share these.
I'm stacking them.
Perfect. Great.
Yeah.
Um,
But yeah, it
Well, it
doesn't look
looks
like
like
we
we
have
did a
any.
perfect job and no questions. Am I right about that, or are there?
No, yeah, no questions here.
Great.
Thank you for a wonderful presentation, Dr. Hovanesian, and thank you to our guests who attended. A recording of the webinar will be uploaded to our YouTube channel, so if you'd like to rewatch at a later time or share with any friends or family, feel free to do so. Also, if you have any additional questions, please feel free to email marketing@harvardeye.com. And other than that, we hope to see you at the next patient webinar. Have a great evening.
Thanks, Gabe, and thanks everyone for attending. Have a good night.
Thank you, Dr. Hovanesian. Have a good night.